Have you ever noticed your dog suddenly limping? Maybe just for a few steps, or maybe all day. You call their name, they wag their tail, but still, they hesitate to put weight on one paw. It's heartbreaking, isn't it? Because dogs can't tell us where it hurts. We just see it in their eyes and their steps. Today, we're diving deep into what that limp really means, why it happens, when you should worry, and what you can do to help your furry best friend heal. Limping in dogs is never normal. It's their body's way of saying, something's wrong. But not every limp means an emergency. Sometimes it's just a minor strain. Other times, it's a serious condition that needs a vet right away. So let's start by understanding the two main types of limping: chronic versus acute limping. There's chronic limping, when your dog has been limping for weeks or months. It may start small. Maybe you thought it would go away with rest. But slowly, it becomes more noticeable. If that's the case, it's time to see a veterinarian. Chronic limps rarely fix themselves, and waiting too long can make things worse. Then there's acute limping, when it happens suddenly. Maybe your pup jumped off the couch, landed wrong, or stepped on something sharp. This type of limping can range from mild to severe. Mild versus severe limping. If your dog's limp is mild, they'll still use the leg just with less weight. You might notice them favoring the other leg when walking. If they're otherwise happy and eating normally, give them a few days of rest. No running, no jumping, just short potty breaks on a leash. But if that limp doesn't get better within a few days, or if it's getting worse, that's your cue to call the vet. Now, if your dog is severely limping, barely touching the ground, or refusing to walk at all, don't wait. That's a sign of serious pain, possibly a fracture, dislocation, or torn ligament. And remember, every dog is different. Some stoic breeds will hide pain and still walk almost normally, while others will refuse to move with even a mild injury. You know your dog best. Trust your instincts. Limping with other symptoms. Sometimes limping comes with other red flags, and these are the moments you don't want to ignore. If your dog is crying, trembling, hiding, or acting fearful, if you notice bleeding, swelling, dragging a leg, or trouble breathing, if your dog seems disoriented, lethargic, or starts vomiting, get to a vet immediately. These could signal something far more serious than a sore paw. What's the first thing you should do when your dog starts limping? Step 1, stay calm. Step 2, assess. Look at the paw. Check between the toes. Sometimes something simple, like a small rock, gum, or a thorn, can cause dramatic limping. If you find nothing, let your dog rest for a day or two. No walks, no playtime. Do not give human painkillers or over-the-counter meds. Many of them are toxic to dogs. If the limp persists or your dog seems to be in real pain, it's vet time. And here's a little tip. Dogs often hide their limp once they're at the clinic, so take a short video of your dog walking before you go. It helps your vet see the real problem. The hidden causes of limping. Let's talk about what could be causing your dog's limp. It could be something minor, like a muscle strain, a torn nail, a small cut or bruise, or even an insect bite. But it could also be serious, like bone fractures, dislocated joints, a torn tendon or ligament, such as a cruciate ligament injury, hip or elbow dysplasia, arthritis, infections in the bone or joint, or even certain cancers affecting the limbs. Sometimes diseases like Lyme disease or autoimmune conditions can attack the joints and cause limping too. The truth is, Every limp has a story, and your vet's job is to find that story before it turns into something worse. Treatment and healing. Once the vet knows what's going on, treatment can begin. Sometimes it's simple, a few days of rest and some prescribed pain relief. Vets often use special anti-inflammatory medications made just for dogs. They're safer and more effective than human drugs. For more serious injuries, treatment may involve physical therapy, surgery, or long-term joint tear. If your dog has arthritis or hip dysplasia, your vet might suggest gentle exercise, weight management, and supportive care at home. Whatever the case, the goal is the same: to bring comfort back to your furry friend, to see them run, play, and smile again, pain-free. Seeing your dog limp can break your heart, but remember, every limp is a clue, not a life sentence. With care, attention, and love, most dogs bounce back stronger than ever. So the next time you see that little hesitation in their step, don't panic. Just listen. Because your dog may not speak, but they always tell you how they feel, one paw at a time. Take care of your best friend, because they'd do anything to take care of you. If you found this video helpful, give it a thumbs up and subscribe to Dogrithm for more pet health and care stories. And hey, share this with a dog parent who might need it today.